So your seat good? Get the mirrors all adjusted. You can see everything okay? Just stay off the freeways, all right? I don't want you going out on those yet. Just leave your phone in your purse. I don't want you texting. Okay?
Daddy, okay.
Okay. There you go. Be careful.
Thanks, Dad.
Call me, but not while you're driving. We knew this day was coming. That's why we bought a Subaru.
Good morning and welcome to Radio Friends. This is Wednesday. It's July 23rd. We've got a topic today that a lot of people do not know much about, and that is hepatitis C. Next week, July 28th, is Hepatitis C Day, right?
World
Hepatitis C Day. I want to introduce you to BRUCE BURKETT. Good to have you here, Bruce. You were Executive Director of Hepatitis C Alliance.
Correct.
What is hepatitis C, or Hep C?
Well, hepatitis C is a blood-borne disease that affects your liver. You can only catch it by blood-to-blood contact, but there's lots of ways to get that contact. And it's something that you could have gotten back in the 60s or 70s and not know you have it until now you might starting to get more damage where you're getting more liver disease, liver cancer, cirrhosis.
Oh, hepatitis C can cause liver cancer?
Yes.
Now, you were telling me that you could have hepatitis C and not even know it.
Right.
It can be in your body for 30 years or more and show absolutely no signs?
No symptoms. Your liver doesn't complain, and your liver also regenerates itself. So you got a kind of ongoing battle.
So then what's the concern?
Well, about 25% of us that get it are going to develop cirrhosis or liver cancer or die from it.
The only way that you can tell if you have hepatitis C, unless you're showing signs, is by having a blood test.
Right.
And you have to specifically ask for the Hep C blood test, correct?
That is correct.
This is not when you go in for cholesterol screening, they take a blood test. They're not checking for hepatitis C.
No, that's they have to test specifically for the virus because it is an RNA virus, but it hasn't been practiced to test everybody. There's a misconception that the only way people get hepatitis C is if they're an IV drug user, and that's not the case. If you had a blood transfusion before July of 1992, or if
Why before July of 1992?
That's when they started testing the blood supply for hepatitis C.
Oh, now if you give blood, it is tested.
It is tested. So if you're a regular blood donor, you're being tested.
Okay.
But if you're not in that group, then you need to ask to get tested.
Is there now you were telling me there's not a charge for being tested for hepatitis C.
With baby boomers and the new CDC recommendations, the insurance companies treat that as a preventable process, just like a mammogram.
Is there, if it is determined that you have hepatitis C in your body, is there a cure for it, or is it only something that's done to help it from getting worse?
Well, for years they thought it would just kind of might go into remission, but there is an actual cure for the disease now. I've actually been cured since 1999.
So you had hepatitis C?
Yes, and I had cirrhosis, and over the years my liver has gone back to a normal healthy liver.
You had cirrhosis of the liver?
Yes.
Because of hepatitis C?
Right.
You were cured of Hep C, and the liver is back to normal?
Correct.
So the liver will regenerate itself?
Right. It's the only organ in our body that will. And it's one of those things God gave us an out because it's the most important one. It's able to regenerate and rebuild itself. And that's why it takes so long to have any symptoms from it.
Are there any signs that perhaps you have it, but it's not screaming out at you?
Well, the symptoms of Hep C are just drop-down fatigue. You're worn out. Your body aches. Your joints ache. Your memory's not very good. Does that sound like anything else to you?
No, it sounds like you got a cold.
You're getting old, or fibromyalgia, or diabetes. That's why it's really hard to pinpoint with the symptoms. Now, as the disease advances into cirrhosis, you might see someone that their belly is swollen way out, like they're 16 months pregnant. That's called ascites. And the fluid that your liver is supposed to filter, when it has cirrhosis or a big scar, it can't filter everything, so that goes in your belly, and they have to go in and drain that.
Okay.
That's a big sign that you have major problem.
Is it too late then for a cure, or can you
No.
still be cured?
You can still be cured.
So the important thing is to check to see if you have hepatitis C. If you do, take care of it.
That's it.
Now, you're having there's a Mid-Mo Health Expo coming up next week, July 28th, 9 a.m. to 4 p.m., Parkade Plaza. Will there be screening for hepatitis C?
There's going to be screening for hepatitis C, and it's a finger stick. You can get your results in 20 minutes.
Oh, so it's not one of those things where they have to draw a lot of blood.
Doesn't have to be a blood draw. We can do that as well, but at the screening, we're going to try to do just the finger stick.
And you will get a positive or a negative result within 20 minutes for hepatitis C. And you're also doing screenings for cholesterol, blood glucose, HDL, LDL, blood pressure, body composition analysis. Oh, is that to show how much fat you got on your body?
Yeah, shows how much we have.
If you could pinch an inch, you got too much.
That's being provided by Boone Hospital Wellness Center. They'll be there.
Okay, and you're doing an HIV and AIDS test also.
Also, you're right. It's a comprehensive health fair. We have over 50 booths that are going to provide it.
Okay, so mark it on your calendar. It is July the 28th, 9 a.m. to 4 p.m. It'll be at Parkade Plaza at 601 Business Loop 70 West for the free screenings. And if people want more information on any of this, a phone number or a website?
Right. Our phone number is 573-442-6599. And the website is www.hepcalliance.org.
Okay. And you also, when you go, there's going to be all kinds of door prizes.
All kinds of door prizes from a $50 gift certificate on down.
But the most important thing is that you can be screened free of charge to find out if you have hepatitis C. And if you do, there is now a cure for 98% of the people. You were saying, what's the statistics of how many people are carrying around Hep C in their body and not even know it?
5 to 7 million Americans have hepatitis C, and 75% of them don't know they have it. Worldwide, we're looking at over 400 million people with viral hepatitis. It's the leading cause of adult liver transplants, leading cause of liver cancer, and a lot of that is because the baby boomers. If you're born between 1945 and 1965, the CDC thinks 1 in 30 of us have Hep C.
Okay, with that, we'll close and say July 28th is the day for the Mid-Mo Health Expo. You can be checked free of charge at the Parkade Plaza. We're out of time for today. Tomorrow, Rebecca Johnson will be here with a veteran and his service dog. Our program directed by Travis McMillen, Reynolds Journalism Institute. Audio, Pat Akers from KBIA. Our floor director is Lowell Thomas, and our assistant producer and guest coordinator, Uncle James Mauser. We'll see you tomorrow. Bye-bye.